Yeah. Let's just see how it goes. Can you see the second slide?
Yes, we can.
Yeah, perfect.
Perfect. Thank you. Yeah, we learn until we leave this planet. Eh? Okay. I did say hi. I don't want to say good morning or afternoon again, but let's continue. Some of us have just woken up. Maybe we can just have a little discussion about this topic that I put there that I want us to cover. Maybe for 5 to 10 minutes, we just chat about what is universal health coverage. And also we're gonna talk about the current state of the global universal health coverage. And then we move to the issues that are affecting, ethical issues affecting UHC in South Africa, as an example, to the African continent. Okay. So this is the screen that I wanted us to look at and just have a little chat about it. And I can't see myself with the screen. Okay, now I can see, that's fine. So I want us just to chat around these 4 things here. Firstly, what is universal health coverage? And what is its purpose or objective? And also, what is the main driver behind it? And also the countries that are here represented in this group. Do you have it in your country? And what is the status? And what ethical issues have you experienced or have you, or that you foresee in your country? Okay. I'm listening. Anyone can start. It doesn't have to be, anyone can just start and pick any of the questions. You don't have to follow the line that I've put them. You can just say anything about it. If your country doesn't embrace UHC yet, you can just say that as well. Okay. You're not sure if your country has UHC? No.
Hi.
Okay, continue. Go ahead.
I'm from Brazil, and here we have the system that is universal. So anyone who come to Brazil can use. We call SUS. And I don't know if the universal health covered would be something like that. So anyone could use that universal health coverage. And in this case, I understood that would be like all the countries involved would be able to use. I mean, I think like in Africa, so all the countries who would be involved in this universal health coverage would be able to use freely. I understood like that. I was thinking like Brazil, we can use freely. Yeah, we pay with our taxes, obviously, but we can use, and immigrants who come to Brazil can use freely the universal health. I understood like that.
Yes, thank you. I think, yeah, maybe it is. I think it is the one that we're talking about the same thing. I'm not sure what in your countries is called. In some countries is called national health system or national health insurance, but the main idea is that it covers everybody in the country. It's that health system that the country is giving. Maybe you can just tell me what type of health system you have in your country.
Yeah, in a case, everyone in our country can use, and who come to Brazil can use too. And so an immigrant, some refugee person can use freely the system. Don't need to pay anything, even if it's someone who is an immigrant or is traveling to Brazil.
Perfect. Yeah, thank you. Thank you so much, Danielle. Do I have anyone who wants to say about the health system in their country, what type they have? Okay, okay, go ahead, please.
Yeah, I live in the United States and we don't have universal health coverage in our country. So it's created a system where, you know, insurance and healthcare is incredibly expensive. And if you don't have an insurance to cover your healthcare, it's incredibly difficult to receive any kind of healthcare, and that's created a lot of disparities and inequalities in who has access to proper healthcare in their country. So yeah, it's quite an issue here, and people are trying to work to change that. But
Thank you. On my side, the sound was very faint. I could not hear anything.
Yes, it's very low. We didn't hear.
Oh, Olaf, I did not hear anything.
oh, I'm sorry. Can you hear me now, or?
You maybe just raise your volume slightly? The
Or
volume
if you
of
could
your
get
speaker.
closer to the mic, maybe the mic
Okay.
is a bit far.
Okay, thank you. All right, try again. Anjali,
Can you-
is that your
Can you
name?
hear me? Yeah. can you hear me now?
Perfect. Now we can hear.
Okay.
Try again.
Okay. Yeah, so I live in the United States and we don't have universal health coverage. So it's created a system where healthcare is incredibly expensive, as well as insurance. And if you don't have a proper form of insurance that can cover a lot of your healthcare costs, it's very difficult to receive anything. So even just getting an ambulance to take you to the hospital can cost up to like $2,000. And that's created a lot of issues within our system where many people can't receive healthcare, and there's a lot of disparities around that. So a lot of people are trying to work to change that, but it's definitely a really big issue in the US.
Thank you. I still did not hear except the word United States and the fact that you say you don't have universal health coverage, but I didn't hear the rest of how the system works. I don't know if anyone heard that to help me, but thank you so much. Thank you so much, Anjali. And I don't know anyone else. Let's try another country and then we go to the next question. I'm just looking for someone who's got a universal health coverage in their country as well, but it is interesting that the different countries have got different systems.
Hello.
Okay, continue.
Yes.
Introduce yourself as well, please.
I am Iman from Egypt. In Egypt, we don't have universal health coverage. The health system in Egypt is categorized into two main categories: public or governmental health system or health coverage, and private health coverage. The public or governmental only for those who are employees in the government, and the private sector is by private health companies. And there are several categories of population in Egypt that are don't covered by any health insurance system. But we are trying now to implement universal health coverage in Egypt, or make an umbrella for those who are not covered.
Thank you so much. Thank you so much. That's an interesting system. Thank you. Yeah, I don't know if anyone wants to go, but can we maybe, and as you can hear, the key word in what she said was umbrella. So it covers everyone, like the Brazil system, it is universal health coverage because it covers everyone that is there. So I think that is the main objective, that anyone who lacks access or doesn't have medical insurance, someone who doesn't have, will be able to continue to receive health services, have access to health services that they need, irrespective of their level, status, or any personal attributes. So I'm not sure if anyone wants to tackle any of these questions here.
Hello?
Continue, please.
Yes, Mwaisungu from Tanzania. I can say a little bit on a universal health coverage in Tanzania, but it almost relating to the other one who have been contributing to. We don't have universal, but the country trying to have a modality which it try to look how their peoples can be having a equally treatment, like having a different rank of insurance, which support different people with a different professional category and the cadre. So it has been tried in a way that all people in a country, they can access themselves from the private who are not being employed by the government, and those who are being not employed by the government, they have a special insurance whereby they can be received too. And those who are not employed, they are living, or the business people, they are doing their own things. They can go direct those private insurance in order to access and have equal services that they can be receiving from the different hospital, depending on the category. But at the same things that have been categorized, this universal health coverage in terms of insurance have been categorized either in different hospital, it might be the gold card, it might be the silver one, depending on the level, which one do you want to be received, depending on the capability of what you want, depending on the services. Thank you very much.
Thank you. Thank you. Yeah, okay, thank you. It is an interesting system, but I see in your planning, you seem to be advanced already, the country, if you've already even managed to categorize the levels of services. Yeah. Okay, because I can't see if you are raising your hand, you can just shout, and if you want to contribute to the discussion, but let's move on to this with the questions. We did mention that it should cover everybody, that whether they are able to pay or not. And also the objectives is an inclusive system that includes everybody, and also the Brazil one includes even people who are not citizens. So as long as you are in Brazil, you will be able to be covered. And we had that in Egypt, the two different systems, the public one caters for the public servants only. Yeah, the main driver that, of course, is access to health services, but the main driver, the main issue is affordability, it's finances, because not everyone can afford it. Therefore, the governments are trying to make sure that people will have access. And we dealt with number 4, but I'm not sure what are the ethical issues that are there, but I like the system in Brazil that everybody, it's a fair system because everybody is included. And also was it Tanzania just now that they are trying to categorize it depending on the levels, or depending on the levels of affordability, isn't it? Okay. All right, thank you. So let's continue with, can you see the next slide? Okay,
Yes.
perfect. Thank you. So this slide is an attempt to define what I got from the WHO on the website to say that in their reports that universal health coverage is the progressive development of a healthcare system, including its financing mechanisms, into one that ensures that everyone has access to quality, needed health services, and where everyone is accorded protection from financial hardships, so that you don't have to worry about paying when you go to get the service. And this, yeah, so that is the whole idea. And as you can see, the picture on the right-hand side, there is a high level. I think these are the countries they are talking about. This meeting is arranged by the UN to talk about this universal health coverage. I'm not sure if the meeting has already taken place, but there were still preparations. Let's continue. I have on, so according to according to the WHO and UHC partners, you can see that small picture on the right-hand side corner is the UHC partnership. These are the countries that have decided they are going to implement or establish this UHC in their countries. There are a lot of countries there. And so I'm just explaining here why UHC. It's when you read there, it's because WHO and the UHC partnership, this report, they say that 3.5 billion people lack access to essential health services worldwide. And where these services are available, there's often the quality is poor and unsafe, and it's fragmented and inequitably distributed. The health system often fails to address major issues, life costs in its entirety, the population-specific needs, the growing burden of non-communicable diseases, and also the unfinished challenges of communicable diseases. I don't think we'll be able to finish communicable diseases, because if we think this one is gone, if we think Ebola is quiet, then something else rises up. Then if malaria is down, then we have COVID, then we have this. But we do have these unfinished challenges of communicable diseases. Now, the idea is to strengthen primary healthcare, which is critical to the delivery of this universal health coverage. And so this UHC would allow, as I said earlier, that everyone will receive essential health services without worrying, without suffering financial hardship. And this is emphasized by the fact that they target 1 billion people, at least more people benefiting from UHC worldwide. So their date was 2018 to 2023. We are now in 2023. This was part of the WHO's 13th General Program of Work. So, and it's based on the Sustainable Development Goal Target 3.8. We all know, I hope we all know that Sustainable Development Goals goal number 3 is about health, and number 3.8 is about achieving universal health coverage worldwide. So, and the focus is about financial risk protection, access to quality, essential healthcare services, access to safe, effective, quality, and affordable essential medicines and vaccines for all. Now, there are reports currently that are telling us about how far this universal health coverage globally, how far the implementation has been, and how far the coverage is in terms of covering the populations in different countries. There is a paper, I think I attached to the readings, systematic study of 204 countries and territories, where they looked from 1990 to 2019. It's about 30 years. They wanted to measure how this UHC was implemented in different countries. And in their report, they conclude that globally performance on the UHC effective coverage index has improved from 1990 it was 45.8, and now it's sitting at 60.3 as of 2019. This is the global overall, but the challenge is that in the high income countries, the index is higher, which means those countries are doing much better. They have put Japan there and Iceland. It means they have managed, they are doing well in terms of coverage. But in the low and middle income countries, especially in Africa, and they put Somalia there and Central African Republic, that in those countries, the coverage is very low. And as I, sorry, let me move, okay. Yeah, so South Africa is among those countries that doesn't have UHC. So there is momentum as well as in Kenya to get the countries to build up and introduce this universal health coverage. I'm not sure if there's anyone in the group from Kenya, maybe can just add there. So this is the map of this group called the Global Burden of Disease of 2019, and they study the universal health coverage collaborators. Is a very long list, it's 2 pages of authors, so that's why they just call themselves collaborators. They are in the map that you have from their report that you see here. You look at that, I hope it's clear from your side. The blue, let me try and, can you see the pointer? Okay, perfect. Thanks, Anna. Right, in the map, you see there's this little legend here or key. And then according to this, the areas that are shown in deep blue and the greenish there and there and there and there. So these are the areas where UHC coverage is very high. And as you can see, it is in the high income countries and the Australia and yeah. So, and you look on this panel here on the left, which is mainly, it's representing the continent of Africa. And it's shown that in those areas, coverage is very low. Okay, let's continue. Okay, this is another report. This report is from a group, it's called the Africa Conference and Commission. These ones also, they were looking at the effective coverage, but they focus mainly on the African continent. They wanted to see how is UHC doing in the African continent. You can see the areas that I've highlighted in red, it's their concerns, because what they found is that for effective coverage for the needed health services, the coverage with this essential healthcare services is still very low, and they say only 48% are covered, and leaving about approximately 605 million people that are not receiving the services. And again, the quality of the healthcare services provided in these countries, African countries, is low, and is considered the poorest performing indicator of UHC. And also coverage with essential health services in Africa is inequitable. So there is no equity there. It means there is no balance, there is no fairness in terms of who's getting what. And they did explain that the rich get better services than the poor. Number 4, they say that the coverage of services for women and girls is also low. It's below 50%. So 49% of them, of the women, had family planning with the modern methods. So, and also in the last point there, let me just remove the pointer for now. They say Africa's health systems are poorly attuned to meet the health needs of the poor, the disabled, the lesbian, gay, bisexual, transgender. So all the vulnerable groups or marginalized groups, they don't, so they are not receiving the healthcare services that they should be receiving because they are being discriminated, they are stigmatized, they get inadequate structural designs. I mean, yeah. So I think by that they mean wherever they are receiving the services and also provision to support their access. So, okay, let's try, and I can see the screen is very sensitive. All right, now I need to come to South Africa now. Bring the, right. So when we look at the ethical issues in UHC, and I did say I'm going to use South Africa as representing the African continent for the mere reasons that if you didn't know, South Africa is ranked #1 in Africa out of the 54 countries. I think there is a belief or a hope that if South Africa succeeds, then the whole African of the African continent would succeed as well. They would succeed. So and also South Africa is got it's not 50 people, that's an error there. It's 50 million. It was 50 to 100 million people. And it is classified as an upper middle income country. I was just telling Anna that I don't know how the World Bank got that one. But from where I'm sitting, I'm happy to classify it as a low, maybe income country. But yeah, we don't know what they use to measure that, because only about 20% or less, those people can be classified as upper middle. Then South Africa is known to have the best hospitals and medical infrastructure in Southern Africa. The health system ranks 49 out of 89 countries. I think this is a global ranking. But currently, as I said, we don't have a system of universal health coverage. There are plans to provide it. In fact, there were plans, if I can remember, as early as 2008. And they put on the 14-year plan to implement it. I think next year there is a push for the government to implement UHC, especially because we are going to the national elections. So still on the South African part, South Africa is similar to the Egyptian system, but slightly different. We have two different kinds of healthcare systems. We have, okay, thank you. Yeah, we have the public and the private. The public one is not serving only the public servants, it's serving everybody that cannot afford a medical insurance. We have the private system. This is catering for people that have medical insurance. And so the public's health system is funded from the tax, 40% from the tax and some patient fees, but it is funded, it's subsidized by the government. And this public health system is the reason why South Africa is planning to implement UHC, because the public health system, I want you to look at the differences, the inequalities or inequities in this table as I'm presenting. So the public health system is understaffed, low wages, and the working conditions are not so desirable, and the benefits. Whereas on the other hand, the private health system is well staffed, the wages are high, better benefits. The public health system is serving 80% of the population. And whereas the private is serving the minority, which is only 20%, or in some cases, they say 16% or 15%. And most of the doctors are trained by government, but once they've finished, they go and work in the private health sector, leaving only 20% in the public health sector. In rural areas, it's only 3% of the doctors really that want to work there. And the environment in the public health sector is not so desirable as well. There are long waiting times, a lack of privacy, and serious overcrowding. Patients just sit in a big hall where the nurses talk to them, and they just crowd everybody there. It's not their doing, but it is the way it is. And it's saving a lot of people. And sometimes they don't have sufficient resources, even like linen, and in some cases, families are called to bring food for their family members who are patients. So whereas on the right-hand side, in the private sector, everything is going very well. There's comfort, the resources are there, it is well managed. Now, the other problem in the public health sector is because there is mismanagement and corruption. There are leadership and governance issues. And also the big cities have good hospitals and are well supplied with resources, whereas the smaller cities and towns and rural areas, they are in shortage of almost everything, of supplies, medication, equipment, staff, and all those. Now look at the ratio of people to the doctor. So there is to one doctor, there's a ratio of 4,000 people. So whereas in the public health sector, in the private, there's 330 people to one doctor. This also applies to the nurses, which is 807 to one nurse, and also 160 in the private sector to one nurse. Now, I just want to show you the current news from the headlines from the newspapers. This is, when you see this one, excuse me. Right. This one, we have a huge backlog of people that need operations in surgery, especially in the orthopedic, the people that are broken or whatever, they need to be operated on. So the long waiting queue maybe it's for years. You find that a child, for example, if a child, let's say they break their arm or leg and they need to be operated, maybe they are 4 at the time or 5 years old. They wait, by the time they get to the queue at the hospital, you find that there are 10 years, 12 years, and maybe the doctors will say, no, but your bones have hardened. Now we cannot be able to operate on you. So that is how long the queues are. There's so much backlog in the healthcare services in the public sector. So this DA, which is the Democratic Alliance, is a political party opposition, which is requesting the Human Rights Commission to investigate really why there is such a huge backlog, and this backlog is impacting on the constitutional rights of people in South Africa, and it says it denies them quality of life. And another headline, it says more than 900 babies have died from avoidable incidents at Chris Hani Baragwanath Hospital. This is the biggest hospital, public health hospital, public hospital in Johannesburg and in the country. In fact, in Southern Africa. So this is where people think they will get better services, but babies are dying there and from conditions that could be avoided. So at the same time, the report in the newspaper said, furthermore, 1,443 babies were born with lack of oxygen during delivery. And the hospital's maternity unit had more than 50 medical negligence claims. So they've been sued for negligence. So this totals about 1 billion. It's just in this unit. There are other units as well. So let's continue and see, given that picture that I've given you, a little bit about Africa, a little bit about South Africa, and now we look at the ethical principles of UHC. So there are 3 models that I've looked at, and I just wanted to see whether these models are comparable and also what issues do they speak to in terms of this universal health coverage. And if indeed Africa is meeting those ethical principles, which ones are being violated. The first one is the ethical principles of healthcare. I've sent a reading. This is by the International Finance Corporation and the World Bank, and it's a guidance document. The second one is the ethics framework for health priority setting in South Africa on the path to universal health coverage. So this is by a report by South African Values and Ethics for Universal Health Coverage. It's a working group and research team that they've just recently published last year in 2022. And we also have the 7 domains of the national core standards published by the Department of Health. Maybe let's look at them separately. This one is published it's meant for people that want to provide services in the country, private organizations, but at the same time, including the government, that if people want to provide UHC services, they must take into considerations these ethical principles, which are published by the World Bank and the IFC. So the first one is respecting laws and regulations. I'm gonna compare it to the current situation. So what they are saying is that any organization or any sector that wants to provide take part in the UHC, it must stick to the principle of respecting laws and regulations of that country. If it's an international company or wherever, but it must respect. So during the COVID-19 in South Africa, we had incidences where there were a lot of people providing service from other countries, but they did not follow the laws and regulations. The first example is the COVID-19 vaccines. We had one COVID-19 vaccine that came from Cuba, it came through the military, and they did not follow the laws of the country, and it did not follow the regulatory authority rules. So that vaccine was returned to Cuba because it did not follow the right channels, the laws. And also we had other vaccines that were brought through some of the political parties. They were from China to assist. But when they were tested, they found that the vaccines were actually fake vaccines. They were not what they were meant to be. And everybody was wondering, how did they come to be and they were not tested? So we had one also from Russia. I think it was called Sputnik vaccine. And that one, when it was tested by the regulatory authority, they looked at it, it was found that it is not safe. In fact, even the WHO did mention that that vaccine is not safe. But all those are the things that are examples of what is happening currently in our countries, many countries in Africa. On the second point is making a positive contribution to society. That one means whatever service you are giving, it must improve the health. It means you must contribute, don't do harm, but you must leave the society with some benefits, especially of the healthcare system. So I just want to give an example from, because some organizations, they come and then you find that they are practicing unethical behaviors. These are big companies providing healthcare. There was this kind of a big case, actually legal case, where in the city of Durban in South Africa, where one of the private hospitals was actually stealing organs from people, human organs, and selling them to other countries that needed them. So that was one, I think that is what this principle is saying, that when you are giving services, make sure that you contribute positively, don't get involved in unethical behavior. The third point is promoting high quality standards. This is the area where Africa is struggling, you know, in providing quality of care, because many reports say that the quality of the healthcare that is provided in the public health system in the African countries is very poor. In fact, there is a report that people are more likely, let me just read the report by the professors at the University of KwaZulu-Natal. They looked at the surgical outcomes in Africa. So they wanted to see what happens to patients that were operated, and they wanted to see their outcomes. And they stated that, in fact, in the low or middle income countries, the patients are 10 times more likely to die than in a similar patient in Western Europe, because of the quality of the service that is being provided there. So that is, and also I've just shown you the cases, those two newspaper reporting about babies dying and also a backlog. So the quality is really not something, there's a lot to work with to improve the quality of the services that are provided. Then the fourth one is conducting business matters responsibly. It's also linked to the first one, because if you're conducting the business matters responsibly as a service provider, you need to respect the laws and regulations. But organizations need to be honest, need to give accurate information. They must not abuse the patients. or they must not, most of them are involved in fraud and other things. So yeah, in South Africa, I just want to give the example of the South Africa where during COVID, the National Health Minister actually was forced to resign because he gave tenders to his family and friends. And also another Minister of Health in the province was forced to resign as well because of similar issues. There was a tender for providing personal protection equipment, and that tender, he just gave it to his friends. And so for that, they were asked to resign in their post. So those are the main corruption in Africa. It's linked to the quality of care because people are stealing and defrauding the system. You know, there were cases in some hospitals where you find that the nurses will steal all the medication and there's nothing left for the patients. So those are the stories that are, so you can see that the patient's rights are being violated. And also the fifth point is respecting the environment, the principle. This one we talk about a lot about the green environment and all that, but we found that there is also in the reading a paper that I attached where they looked at the services that can of disposing waste, and they only found that in South Africa they haven't they don't have proper systems of disposing the waste, and they dump it anywhere, and they don't even have for facilities for temporary storage of medical waste from the hospitals. So that is another issue, another principle which is not being adhered to. So when I looked at all these 10 principles, I noticed that there is actually no single principle that we are currently adhering to. So upholding patients' rights, that one as well. It is another problem. There is in this, let me just go down quickly so that I can, I wanted us to look at this patient's right before the Patient's Rights Charter. It's been there for a long time, but it's not adhered to, that the patient has a right to dignity and there's a right to health and safe environment, participation in decision-making, access to healthcare. But all those rights of the patients are being violated. So there is no adhering to that principle of respecting the patient's right, and which is also ties in with the principle, ethical principle of autonomy and respect. Okay, let's go to the sixth principle, which is, or seventh principle is safeguarding the information and using data responsibly. This is another principle which is not being adhered to. Despite the advancement in technology, most hospitals are still using paper-based information systems. In some cases, there is no protection of information. So if you are a researcher, maybe you want to go and get information, that information is missing, is incomplete, or is not there entered. So we still have all these challenges, ethical challenges of providing that should go hand in hand with providing an effective UHC system. Let me finish, go to item principle 8, which is preventing discrimination, harassment, and bullying. I've just shown you in the report by the African Health Agenda International Conference that there is discrimination and harassment or bullying or stigmatizing the vulnerable groups. So we still have to work along that and embrace. I know in some countries, even some of those groups are not recognized. In South Africa, we still have a big issue in the hospitals of migrants, international migrants, because unlike the system in Brazil where everybody is allowed access, they should be allowed access in South Africa, but when they come to the hospitals because of language barriers and other barriers, so they are not actually receiving the quality of care that they are expecting. Now, the principle number 9, protecting and empowering staff. This one is another challenge because when you look at, of course, in the private health sector, the staff they are enjoying benefits, better working conditions. In the public health sector, we are faced with, every now and then, I can tell you, we are faced with staff protests, staff strikes because they want better conditions, they want better salaries, the staff morale is very low. So every now and then we're faced with sort of strikes and those protests from the staff because they feel they are not being empowered, and also because there are so few of them working so hard and long hours. Okay. The principle number 10, supporting ethical practices and preventing harm. This one we know the ethics, the main ethics deriving from this principle says do no harm. But as I said, according to the national academies, they say that even if the world were to achieve universal health care, billions of people would have access to care of such low quality that it will not help them. And indeed, often it will harm them. So that is the challenge. You saw how many babies die. The major challenge in South Africa is the issue of mothers dying when they are delivering their babies, and at the same time, their babies dying before 1 year, infant mortality, child mortality. So those are the issues. There is more harm in the system that, you wonder how the UHC is going to work, whereas all these principles are still of ethical principles of healthcare are being violated. So I want to come to this one. This I won't go into much detail, but what I want you to see is that this is the one from South Africa. It's similar. You can see there's health benefits and harms, cost effectiveness, budget impact, personal financial impact, solidarity and social cohesion, ease of suffering, impact on personal relationships. Most of them talk about patients' rights, impact on safety and security, yes, of protecting the patients, and also respect and dignity, still talking to patients' rights. So this group, they've highlighted 12 principles and this, and also the systems factors and constraints. So there are so many. They are linked to the other one by the IFC and the one that I was talking about just now, and the WHO or the UHC partners. But you see that this one has got, they've just clarified, they've specified, but they are all linked. The issue is we still have ethical issues that we need to address. And the main question is, are we ready for this UHC? And if all these factors are still need to be addressed. And also this is the ethical principles in the 2015 white paper on national health insurance. You can see this one was released by the Department of Health, South African Department of Health. But they still talk the same thing, appropriateness, equity, effectiveness, social solidarity, health as a public good, affordability, efficiency, right to access. So, and also the last one of these frameworks is the 7 domains. Maybe I should take a break here and give you a chance to ask questions before I wrap up. This is the last slide, one of among my last slide, maybe allow you to ask a question or maybe to add, if you want to add anything, and hear whether, let's go back to this one, so that if you want to ask a question, you want to add something. Okay, or should I just finish and then we can discuss, because I think it's just one slide left. Okay. All right, let's just finish now. So let's go to the next slide. I did this one that it is similar. The issues are the same. The ethical principles are the same, irrespective of where they originated, but they all talk to the efficiency of the system. If that system is not adhering to these principles, then it means we would have failed, the patient would have failed as a country to provide the required health services. Then this one is the national core standards for health establishments in South Africa. They still speak to the same ethical principles. It's called the 7 domains of the national core standard. You see the patient rights is there, patient safety, clinical governance and care, clinical support services, public health, leadership and corporate governance. I mentioned that the problem with leadership and corporate governance is corruption, it's fraud, it's all these other things that they stealing from the system and deprive the patient of their right to access the health care. And also operational management is still the same. And if it's not the leadership at the in the office, maybe in the cabinet, let me say that, in the cabinet, then you have the leadership in the hospitals themselves or the staff as well. As I mentioned, some were stealing linen and medication from the hospitals to a point where now you are required to bring linen to the hospital when you take your patient there, and there are no facilities to bath the patients. They call you from home, say, come and wash your patient, come and wash whoever, your family member from the hospital, because we don't have the necessary resources. So those are the challenges, and also the facilities and infrastructure. This is a big issue, especially for the medical schools that are training doctors in these facilities. You find that there is no facilities, there are no, the equipment is not working. You want to take simple blood pressure machine, is not there, or any other type of equipment is not working. So you see that if you don't even have teaching tools to train doctors or other health personnel, so how can you provide the whole coverage health services to the whole country if you have so much shortage? So those are the really ethical issues that we are grappling with, not just in South Africa. Remember, I said South Africa is #1 in the African continent. So out of the 54 countries, you must start thinking now, if the #1 country that people are hoping that it will do much better than the rest of the continent, if the #1 country is still battling, what about the rest of the continent? So that is the issues that they apply to South Africa, they apply to the rest of the continent. And I just, as I conclude, I just want you now to ask your questions, and also put the patient's rights charter there, whether, because also this is the core of the universal health coverage, that they put the patient at the center so that the patient will not suffer any harm. The patient will enjoy the benefits that are given by the government. But according, you see those three models of the principles, ethical principles, we are still a long way to delivering. And yet next year in South Africa, we're supposed to implement it. I know Tanzania said they are working towards that, even though they are far advanced in terms of their planning. But for us, Parliament has just approved the National Health Bill, and so we've got no choice but to implement it come next year or the other years that we're supposed to implement it. But the big question is, will it be an answer to the health inequalities, inequities, the injustices that we are seeing currently? So from what I presented, from what you know in your country, maybe you can help me answer this question. Yeah, I'm gonna stop here, Anna, and let take questions if there are any, or just any comment. If there are any comments.
If I may, I live in
Go
Lebanon.
ahead, please. Go ahead.
Thank you. I live in Lebanon. I'm Lebanese, so what you are describing actually applies a lot to our situation, the corruption and the financial issues, particularly now that we're passing through. From a point of view of someone who is living through this, I don't think anything can be done that would be useful and practical before the whole political system is reformed. Reform is essential. I mean, talking about health coverage, universal or otherwise, any sort of health coverage under the umbrella of the government or the private sector. The private sector is a bit more reliable because it gains a lot from that, so it's sort of a business. But generally, with corruption, with favoritism, and this is also all here. We suffer from this also in Lebanon. No system is useful. Our system on paper, actually, in Lebanon, our health system on paper is wonderful, but it's all on paper. So before you solve the other political and ethical issues that the community is suffering from, I don't feel any system can work. Thank you.
Thank you so much. Yes, it is a pity that the private health sector is working so well, and yet it's serving such a minority. And now what they're trying to do is through this universal health coverage, to make sure that people enjoy same services that are enjoyed in the private health sector, but through the public health sector. But yeah, thank you for contributing to that. I see there's a hand. Go ahead, please. Daniela, is it you?
Hi. Yeah,
I can only see 4 people. The rest I can't see. I'm not sure how to increase my camera. Go ahead, please. Sure.
Okay. Well, I would answer this question with maybe. I don't think only the universal health coverage will be the answer. Will solve all the problems. as I was saying, Brazil has an universal health, but it didn't solve all our problems. We have so many problems here, and we have inequality, we have problems with the system. We have a big country, and it's a challenge to give health, to assist all the cities, all the population. So just have the universal health system is not it's not the solution, but it helps. I think it helps a lot. So in this experience of the COVID-19, we had a government that was very bad to this situation of the pandemic, but the fact that we had a universal health system, it helps a lot, even if the government was making bad decisions. The fact that we had this system, it helped. So we had we had the workers, and we had an extra I don't know the structure a base to help the population. So I think if we didn't have that, it would be very worse. We had a big problem in the pandemic, but if we didn't have this universal health system, it would be very worse than what we had. And in this case of vaccination, our health system had the possibility of giving vaccination for all the population, even if the government at the time was trying to not vaccinated. The fact that we had a system, a health system that had the experience with vaccinated population in other situations, I think it helped. So I think it's not the only solution. We still have problem to guarantee that the health system will go to all the population, people in the low cities and with poor people, but I think it helps a lot. So I think it's something you should try to get to the universal health coverage. Is the beginning. I think that is the beginning. It's not all your problems will be solved, but it's the beginning of a long path, you know. I don't know if I could explain well, so sorry for my English here.
You explained it so well. You did explain so well. Yes, yeah. I like the idea that you say it is the beginning, because it will reach out maybe the people that cannot even afford health care. And as you say, the ethical challenges will continue. And I'm just glad that it's not the problem only in Africa. The earlier person that said is from Lebanon, that the issues are there, corruption is there. So corruption is a worldwide ethical problem, you know. So, thank you for contributing to both of you. I see there's another hand there from, let me just see who, somebody else raise a hand. Harrison, or I'm trying to read the name. Go ahead, please. Yeah.
Yeah. Hello, everybody. Okay, my name is Bola Harrison. I'm a Nigerian. And just, it's not really like a question. I just want to react to the slide here because the idea of universal health coverage, it's something that they started in Nigeria. In theory, it said that Nigeria has universal health coverage, but in practice, it's not so, because we have a lot of populations that do not have access to quality healthcare. And the health system is one that is divided to government owned health infrastructures, where it is said that everyone can get care regardless at a very subsidized rate, not necessarily that you have to pay for it, but the health system is very mismanaged to the point that citizens or visitors or those who are residing in Nigeria don't have access to basic care. So I think that the idea of universal health coverage is one that the African continent needs to take seriously. Not just universal health coverage, but health itself. Because like you said when you were doing your presentation, that the turnout for African countries were very low. And I think that there are other societal problems that impact the health sector in Africa. So I think for African countries like Nigeria, the starting point would be to address the efficiency of the health system first before making new policies like the universal health coverage, because I don't even think that the health system is sound enough to even bring policies like this in. In theory, we have it. In theory, it's not even working in practice. So I think that health injustice, health inequality, they are very serious issues that I think that people need to take seriously, especially from the government level. Because during the COVID, I remember Nigeria suffered a very serious impact because they were not ready for things like that. Nobody thought something like that could happen. And when it did, there was no health infrastructures in place to attack these problems when they started coming up. So I think we need to think towards the future and look for how to make healthcare system accessible from basic health to before we can talk about implementing health coverage for everybody. I think that's my opinion.
Thank you for that contribution. And I'm glad that someone from Nigeria is contributed, because there's also an issue between South Africa and Nigeria that who's number one, who's rated as, sometimes Nigeria is rated as number one economically, but then, yeah, there's that competition. And you are right, the policies, the plans, they are very good on paper, in theory, throughout the rest of Africa. And also it's because WHO is forcing them to have those plans. But at the implementation level, we have serious issues. And someone said that unless the government is reformed, then yeah, unless we must have ethical leaders for them to be able to implement things ethically, I think. Yeah, so thank you so much for that contribution. Funny enough, South Africa was very ready for the pandemic, except that the vaccines delayed to arrive because they came from the other countries, but the rest of Africa was not ready, and they could not, because they could not even make their own vaccine. So we received the vaccines late, but the infrastructure was there, everything was in place, the government was very ready. But I hope, yes, as you say, the universal health coverage, we're talking about it, it's because WHO is pushing the countries to talk about it, to have plans and to report. But at the grassroots level, that is where the issues are. And even if other countries put in a lot of money to the donors, put in a lot of money to better the health systems in Africa and other low-income countries and internationally, The problem is mismanaging those funds and stealing them and giving them to people who don't really need them, and the needy and the poor don't get those services. Thank you. Do I have any other person to contribute? So I have 2 or 3 answers to this question that Kathy, I thought you wanted to say something, sorry. Okay, no, that's fine. I thought you wanted to answer the question. No, that's fine. Yeah, so I'm not sure if there's any last comment before I bow out of the communication, Anna.